Hi everyone, I am Dr. T.S. Srinath Kumar, Group Head of Emergency Medicine for Herzberg Group of Hospitals, Hyderabad. I am also the Treasurer for Asian Society for Emergency Medicine, and it's my privilege to talk in front of you regarding the topic which is very important on leadership in emergency medicine. And this is the 12th Asian Conference on Emergency Medicine by Asian Society for Emergency Medicine, India. Why you have to know about leadership is because I am aware that around the world, the emergency physicians who come out after the residencies directly or indirectly become the leaders in emergency in their departments. So it is important for them to know what are the qualities and what are the things they have to follow in emergency specialty when they become the head of the departments. So these 6 things which are very important for them to lead is the leading guiding principles for emergency department. That's what I feel. So what is your expectation? What do you delegate? How do you encourage? And then the correction, the review with the acceptance. So 6 things which you have to keep in your mind. So the first and foremost thing is always keep your high and clear expectations. That is, look into the demand and have the demand high performance. And then instill, which is important for them who are becoming the residents, going into the HOD post, and then what they are expected from their residents. To instill them the confidence what is required and express the exceptionalism in the teams. But at the same time, you have to be consistent in your style, vision, feedback, openness to ideas. So these are the things which you have to be ready. And then delegator. All the time what is important is you should not keep everything within yourselves. You have to delegate the work among all your consultants, residents. What are the things you can expect as a delegation? That is very important. Trust. Trust is the most powerful motivator. If you don't trust among your residents or among your juniors, then there is no question of you becoming a leader. Then help them to elicit the skills, not to limit the skills. Like somebody has a bright idea today, they wanted to try out something. Okay, allow them to do and elicit the skills that will bring in more and more confidence in them, more and more boost they themselves. So that is very helpful for them to bring out the skills and show it to you. Like somebody in my department wanted to do a test called for trypsinogen, which was very important for acute pancreatitis. So she came up with this brilliant idea. She herself browsed in where it is available, and that's how. Then it became an important hallmark that how you have to test your acute pancreatitis in emergency department without wasting your time for lipase, amylase levels, just a urine dipstick test, what you do for a decay with ketone bodies. So that is how when you expose them, they bring out their skills, they bring out their knowledge, and that will be helpful for all of them. When you do this one, I am sure that you are going to encourage the step change growth. That is what a leader is expected to do from their sub-juniors or juniors. So when you do that one, you are offering them the advanced opportunities, and also the second line is being brought in forward, because you cannot do everything. Your second line is the important one. If you don't have a second line in your department, you cannot go like what we do, go for conferences, give a talk, but at the same time somebody has to take care of our work in the emergency department. That is the reason why your second line, third line, fourth line should be developed and allow them to grow up. That is how you're going to give them a pathway, learning curve, and the growth. So these 3 things is very important for you to exchange. And then when you do this one, I'm sure that you're going to have a connected between your team. Connection is important pathway between you, your team, and the residents. When you are connected in these 3 layers, that means that you are going to be the best leader in your department. Have a real performance review process, including of yourselves. When you are looking in for performances of others, you should think of yourselves also, which is important. Otherwise, what will happen is they will be outperforming you and you don't know that you are lagging behind. Only when you do in a stepwise manner and look into the performances, then your growth will be measured and you can set the objectives, milestones for the year. Always give the listening ear. That is very important. When you listen to somebody, what they are telling you, you may get the brilliant ideas which can utilize for the upliftment of the department. Make process clear, and whenever you want to shout at somebody, don't try to shout at them in the department itself. Take them aside, give them their peace of mind, give them in the positive way what are your positives, then bring in the negative. That is what it is called as Berger method. So follow this when you are a leader, and then have a real performance review. But when you want to fire them fast. If you feel that this person is not useful for your department, he is becoming a menace for you, that means that you have to act fast and be firing also. But at the same time, give them the respect what they have done for you. And at the same time, you should also look in for an alternative position and find that particular person who will be helpful for you as you want to delegate at that particular responsibilities. Accept the churn. Whenever somebody is moving out, accept them. Whenever somebody wants to move out, they are getting a better position. They are going in as a leader into other department. You have to accept this, and then try out. More succeed and more leave, but more talent will be attracted towards your emergency department. When you think that one person has gone out, what will happen to my department? No, you have developed already your third level, fourth level. That is what will importantly churn and bring in the safety to your department, which is much required. And then this is the exercise which always I give to the residents or to the consultants to look into, and look in the 6 important things, that is action and results, creativity, mentor apprentice environment, advancement mindset, cohort competition, and inspirational vision. So when you keep these 6 things and give them as an exercise for them to look into and bring out them and look into the results, and then explain to them what they have done rightly and what they have done wrongly. When you do this, the 6 behavior in your people will come out in the best way what you want. Ownership. Whenever it's important that in the department, as you develop, you are the owner. In the same way, the next person should also be developing as he is the owner of the department. When you are not there in the department, they should feel, yes, my boss has left me and I have to take the ownership and be proactive, do the things right way, what he was doing, and take the legacy forward. Then you are going to become the good leader. An attitude of accepting the responsibility for something and taking control of how it develops. That's what I was telling you. Now, performance. Every person will have their goods, bads, but the best will always be there. Recognize their performance. Give them the positive consequences and look into what is going to give the negative. Like if somebody wants to give a good, say that, okay, this was my best nurse, this was my best resident. At the same time, there will be other people who will be in the department thinking that, what is this? I am doing so much of hard work. My HOD is not giving me the responsible or the performance recognition what I am deserved to. So then that will become a negative consequences. So you have to keep in your mind. I always suggest that take as an inclusive, like what we are as a team. Take the inclusiveness and take it forward, then you will always have a positive than a negative consequence. When you are giving somebody the rating, give them the 5 times. What will happen when you tell them by name, when you recognize by them their name, they will get 5 times more likely to feel valued. They will always feel my HOD has always had an opinion that I am the best, so he always give them the value. And when more number of performance are there, you give them 7 times more value. That will give them, they will add on the value, they will stay back with you till you are there in that particular hospital. So that is how you always have to churn them. That is what is important as a leader, you take them forward. The next important thing is staff engagement. Have a monthly meetings, review meetings, call everybody, take their inputs, make a note, send us a minute of the meeting to all of them who are there in the department looking after that. Then what will happen is you're going to get certain ideas which are positive, which may be negative. The negative one you keep it aside, take the positive one which is important, especially when you have, like there is a budget every year. So you call them, you ask what you want for this next financial year. What are you going to do? Okay, I want an ultrasound machine. How do I get an ultrasound machine? Or how am I going to put forth for it? Because it's a financial planning. It is a strategy. Then you have to say, yes, I put a central line. With the help of ultrasound guided central line, it is going to reduce the complications. And also you can say that, okay, I will add a value for it because I am doing a ultrasound guided procedure. So this is how it will influence the development of the emergency department growth. So then you are going to be a good leader. Communication. Very important. Communication is not only to you have to do with the individuals, you have to do with your colleagues, residents, those who are coming into the department, those who are your managers on duties, your PREs, your billing people, your administrators, everybody. One-on-one meeting is always good for them in a periodical way. Like what I said, in a monthly manner, you can have it once in 3 months. Give them the performance. Once the performance has come in front of you, tick it down. What is positive, what is negative. Tell them in a burger method that will give you the best important thing between the connect between you as well as the other colleagues. And then provide them an open door accessibility to the management. Whenever you feel that you are unable to clear it, you go with your colleague, take them to the management and then say that this is what is required. Increasing is important between an employee autonomy, flexible and support. These are the three things which is the next step which is required you as a leader. If you do a micromanagement, you will be a failure. You always do macro management. Delegate the things, ask them what they have done and get it back to you, analyze them. Then that is macro management. Micromanagement, you delegate a work and again you go back and ask what has happened to this, what has happened to that. That means that the particular person whom you have given the responsibility, he will never complete it. Always have an alternative working pattern. And sometimes you have taken exhaustive work from somebody with your colleague or your resident. Maybe yesterday, day before, it was busy in your emergency department. Today, after a certain time, there are n number of people and you don't have much patience in your department. So you can ask them to leave. They'll feel happy that yes, my HOD has recognized my work and he has given a few hours of permission to go back. So like this, you have to explore the newer opportunities, do the newer things which is important for the department. Time is very critical, like let it be a cardiac arrest, stroke, myocardial infarction, anything. But there also is time. Again, as a leader, every second, every minute, what your thought process goes is also time management, especially when there is problem solving. You have to look into which is critical, which is less urgent, which is low and which is high performance. When you divide your work, when you divide your problem into these four, then you will become a good leader. So, how do you solve the problems? First is routine decisions, like somebody is coming for a quality work. The NABH or something is scheduled 2 months later on, but he is waiting for you and he wants to discuss with you. This doesn't become a primary work early in the morning. Your early in the morning work is look into the patients, what they have come yesterday, and look into what are the other challenges, like somebody is fighting outside. Somebody wants to have a discussion with you. There is a class with you. So you prioritize them. Which is the problem which you can solve immediately? Because when you churn out 100 number of problems, 80 of them can be solved by itself. Another 10 your intervention may be required, 10 your second line can add up the value. So like this, you have to break down and look into what type of a problem is there, how you can look into it. Cost of your decision making process, whether it is monetary or non-monetary. Decide that one. You want to check out somebody, that means that you are going to lose, whether it is losing your revenue or it is just a non-monetary one. You have to think like this. Then how do you have a flow of event? First is always look into the problem, define it, gather the facts which has led to the problem, develop and also wait for the alternative solutions. Now 2 students are there in front of your door. One is saying that I have a engagement tomorrow. The other person is telling that my wife is somewhere outside, I have to bring back. So which is important there? Engagement or bringing his wife? So here you have to decide which is the most important problem, how you can solve it. So this important things of selection of your solution will lead to a successful leader in the emergency department. Once you have looked into the selection, then you can implement the solution into this, and also you have to measure the consequences. Now somebody who is on COVID duty is COVID positive, and then the other person is coming inside, is coming delayed. You can always tell that the COVID person, you can ask him to stay back home, he can take rest, which is important for him. But the other person, if he is asking for a permission of 1 or 2 hours late in duty, you can pitch in that time. You can look into. So that what will happen is, the other person who is coming in will always say, my HOD is already in duty, so I have to come fast. So that is how you can measure the consequences and then implement the solution. So that you have to look in. How better you can do it. This is what is called as SWOT technique. What is SWOT technique? Strengths, weaknesses, opportunities and threats. So these 4 things, when you analyze in your leadership activity, you are going to be the best. And then when you do the SWOT analysis, you have to look into what is the competence and what is the commitment. So what is the competence? Like there are 4 people, you want to throw one person out. One person, among these 4, one person is always late and he is not regular for his duties, he is not listening to you. The other person, he is very good in his duties, he delegates works, he takes carry forwards his work. Do you want to throw him out? No. The person whom you feel that it's a burden for your department should always be known as the less commitment, less competence, and you can always set him aside and you can give him the Berger method, that what is his positive, what is his negative, and then take him and say that this is the best place for you to work, and allocate a work which is less important, which can develop him as a good second line. The other 2 things is hygienic factors and motivators. So whenever you feel that there is a person whom you want to recognize and there is, you can grade them A plus B, B plus, like this. So accordingly the pay, the job security, the status, everything keeps increasing. And especially your working condition, like what I said, yesterday, day before, it was very busy. Today there are no patient. You can always say that, okay, you can go and take rest. Like this, it's important to help him in the working condition, working relationship. So what will happen is, it will go to create interest. You will say, oh, my HOD has already recognized my work, what I have done. That is why he has given me that extra off which is required for me. So he will feel more and more, and he will help in the promotion and the development of the department. That's what was Herzberg's theory. So to tell you more important, that is the growth theory. What is growth theory? It's setting a goal which is important, what can be realistically achieved, and what are the obstacles which can happen, and will they go forward. So when you do this theory, and then you can see that what you have to face at reality is a reality. So like this, always what we in emergency medicine, we believe, you believe, I believe, everybody believe is, you are not individual, you are a team. When you look into this, you are growing a far ahead rather than keeping back in your emergency department itself. You do with a team. You always should say that I am doing, you should not say that I am doing it. You should always say we are doing it. We as a team have got the delegation, got it rightly, and we are successful in the emergency. So that is the speciality of a EM leader. You should become an EM leader. Everybody should become an EM leader. That is how the next person who is nowhere concerned to me called me and said that you have been given an extraordinary person for the year 2022. They called and they gave an award saying that you are the dynamic person. So like this, it is not only for me, it is for you. Tomorrow somebody should recognize you and say that you are the best leader whom I have seen. That is what I always think, we always think. That is the motto of Society for Emergency Medicine India, where the 3 arms are academics, research and service. In the same way, I expect you all to move forward as leaders of emergency medicine. Thank you.